custodial sentences that have been and are being expected to be issued are greatly dissuasive, I think, and have really added to that hostile sort of conditions and publicity to prevent and dissuade people from attending to the festival to try and supply drugs. And we've really worked in partnership with Festival Republic to tighten up both the ingress protocols to make it really hard to ingress with drugs, and then if people do get them through, the subsequent protocols on site to catch and arrest those responsible.
Thank you very much. That's really useful. I'm sure the public will feel reassured by those figures. I'm going to go. Let's go from the left. Nick, you've already spoke. Is there anything else you want to add?
No, I'll keep it quite brief. Successful traffic management plan worked again. We're looking to carry that forward for this year's event. I look forward to going to the various subgroup meetings that do help make this a successful event. So yeah, it's very good from our point of view.
No, I'm not. I'm just on the Festival Republic Working Group. Yeah. But I'd be happy to attend it if that's okay with the group.
Yeah, of course.
Yeah.
Yeah. You
or Matthew, yeah. Yeah. Thank you.
Thanks, Nick. We've got Dave next, please, from National Highways.
Thank you, Chair. Yeah, our feedback is very much in line with what's been presented by Festival Republic and by Nick on behalf of Leeds. The traffic management plan from our perspective worked really effectively. There was some disruption during the arrivals period due to the storm, but I would just add that the traffic management provider from Festival Republic AA Signs were very proactive prior to that as well. They took a lot of efforts to make sure that the signage that was deployed, particularly out on the motorway network, was well secured and weighted down. We did have some minor issues with signs blowing down, but those were rectified either by our traffic officers or by AA Signs once the winds had subsided. This year we took a slightly different approach for the egress during the Sunday night. Some really good joint working between National Highways and West Yorkshire Police managing that, and I think that was seen as having improved from the previous year, and we're looking at some very minor tweaks to improve that again for 2025, but overall a successful operation. Thank you.
Thank you very much, Dave. We have West Yorkshire Fire Service next, I believe.
Thank you, Chair. So from a West Yorkshire Fire perspective, so we've proactively engaged in the pre-planning, which has been really useful. They've even set up there was a separate meeting to discuss certain provisions of the fire towers, which meant through the assurances that the organisers have given us and the measures that are in place, we were able to reduce certain measures, which is really, really good. Having representation in the event control, again, it is a low-risk event in terms of West Yorkshire Fire Service. However, that overall awareness and eyes on the ground, particularly Friday morning, where I believe a lot of high-level discussions were going on. So it just gives us that early opportunity should we need to sort of assist and intervene, we can do. Just one observation regarding the high winds. Obviously, it was discussed through the pre-plan, the tabletop exercises, but further development in those sorts of areas just to make sure we've got everything covered. But other than that, yeah, really good, really proactive, really positive from our experience, and we'll continue that moving forward.
Smashing. Thank you very much. Claire from Safer Neighbourhoods.
Hi, yeah, the Leeds Antisocial Behaviour team, we didn't receive any complaints with regards to the event. We didn't have any officers necessarily on the ground on the day, but we didn't receive any post-event, so that's quite successful.
Great, thank you very much. Is there anything else you'd like to add, Dan?
No, nothing else. Thank you, Chair.
West Yorkshire, it's Chris from West Yorkshire Ambulance Service.
No, just thank you for confirming Elite EMS, so we'll set up a meeting as soon as possible. The original casualty data shared did look inflated, but we've actually recorded contacts made by members of the public with medics rather than treated. So looking at the actual data, it was very similar to last year and represents a medium casualty data, and that's what we normally expect for an event of this type and magnitude. So no further points, thank you.
It's just worth noting that we talked about this in more detail in closed session as well for anybody who's watching. So yeah, all of this sort of stuff, including medical providers and provision and all that sort of stuff, was discussed in detail. We've got taxi and private hire licensing, please.
Thank you, Chair. A very successful weekend in relation to taxi and private hire licensing. The traffic management plan was relayed to the licensed trade in the weeks leading up to the operation. We had officers at the festival on each and every day. During the day and the evenings, they were undertaking inspections in the quieter times. We received 2 complaints from members of the public, and these related to overcharging. We also had officers working from Wolverhampton, Bradford, and also the neighbouring authorities. On the whole, everything seemed to be okay. We did get reports that they were struggling with the Wi-Fi signal on the Friday and Saturday. That's just due to the increased numbers at that moment in time. But the staff provided to assist the licensing trade in the pens with the organisation, that did work. So everything seemed to be a lot better this year. Thank you.
Good. So you managed to get some of the enforcement staff from Wolverhampton, did you, and Birmingham to come?
Yes, we did manage to get enforcement officers from Wolverhampton to come and work. An event of this nature will attract vehicles from out of area. As we all know, Wolverhampton is the largest licensing authority at the moment, so they did come and assist us to help with their vehicles.
Good work, well done. Ruth, is there anything else you want to say?
Yeah, just in relation to public safety and health and safety, obviously we have officers in attendance prior, so when it's the build and set up, with building control inspectors as well, just to make sure everything's safe. Obviously the weather played a massive part this year, but things were dealt with brilliantly, communication was great. So yeah, there was no, any issues that were raised were dealt with at the time. So yeah, there's nothing more to add from me.
Thank you. Ruth? Jason, did you want to add anything, or you? I'm conscious I skipped you, but you are part of the same team. Entertainment licensing.
Thanks, Chair. No, everything really is so minor, it's not really worth mentioning. We fed it back via the SAG, and Festival Republic are aware. I think the only learning really is from the storm about maybe a review of the contingency plan to address displacement temporarily of attendees. And we just had we noted that the Wi-Fi was very weak around the site, not just in the taxi area, but also around the site itself, which it does cause problems for welfare. Groups being able to contact each other and parents being able to contact the, people on site. So if Wi-Fi can be bolstered, that would be a big help as well. That's it for me. Thank you.
Great. Thank you, Nicola. Just on the Wi-Fi issue, is there anything we can do about that?
Chair, we don't actually provide Wi-Fi around the site. We did provide Wi-Fi at the drop-off, pick-up and drop-off as a specific, as per the discussions here in this committee for WhatsApp messaging between taxi drivers and customers. What we do try to provide is the is 3G and 3 and 4 5G signal via the telephone companies. We are at the mercy, obviously, of the telephone companies to provide that. To provide Wi-Fi for the whole site would just be impossible. That said, this year for 2025 and onwards, I'm bringing in a new what's called a neutral network provider to provide the 3, 4, 5G around the site, and that should mean that all of the networks, not necessarily 3 because they're our sponsors or whichever ones, all of the networks should have really decent coverage via the neutral network provider. The individual networks are not providing their masts. I'm effectively providing a circle of masts that the networks will buy into and attach to in order to give us much better service. That's the intention, Nicola.
two other officers left. We've got Nick from Frankin.
It's my writing.
You're terrible writing. Nick, if you'd like to update us on salvage, I did specifically ask that you come as well, so I really appreciate it that you're here. Thank you.
Thank you, Chair. So just in terms of a quick update, we received the sustainability report yesterday, so I would welcome an opportunity to discuss the data and the calculations behind that with Festival Republic soon, please. But generally, on the whole, we were quite, on a positive note, quite impressed with the 78% composting and recycling rate, and the zero waste to landfill is obviously very good. We'd like to look a bit further into that 22% of the waste and maybe improve on the 12% reuse as well. So I'd welcome a conversation maybe around using our services, sort of vehicle and people resources to help out with the salvage and see if we can do a bit better. Just from a street cleansing point of view, I'll also just quickly mention that generally in the locality around the festival, we didn't have any issues as such. The high wind brought down some branches onto pavements and roads, but we managed that. And then just in the city centre, although we did experience the queues around Sovereign Square, to be honest, the litter impact was fairly minimal. We put out extra litter bins and we also had extra litter pickers. So we managed to clear most of the food and drink waste that we experienced there. So from a street cleansing perspective, it was quite a positive outcome.
So do you think somebody from your team will be able to go on the salvage working group or whatever it's called?
Certainly, yes, I'll be representing on that working group. I was part of the sustainability group. I think we met once in May, but I'd hope we could get a bit more done this year.
That's brilliant. Thank you very much. Ed, is there anything you want to ask Nick? Dan, sorry, I left you out.
No worries, and thank you, Chair. So I'll just give you a brief update on the Look Out for Each Other campaign. So this campaign, just to remind committee members, is a drug and alcohol and wider health and wellbeing and safety festival campaign. It's been developed by the Reading and Leeds Festival Advice and Campaigns team, which is a collaboration between Leeds, Reading and Festival Republic. That's chaired by myself. It's based on 12 animations. They were played on the big screens during every changeover at the festival. And in addition, the campaign messages were on the air hub walls and also on waterproof mobile phone pouches that were distributed at the air hubs. There were 15,000 of those. In addition, the hashtag for the campaign was on staff uniforms, temporary tattoos distributed at air hubs. For the first time, it was on the main festival poster, as well as the main stage scrim, which is effectively the roof of the main stage, and also on merchandise for the first time this year on T-shirts and hoodies. In terms of the festival app, there were over 184,000 users of that app, and the hashtag was featured at the top of the homepage during the festival and also in the months leading up, and 26 campaign notifications were sent out during the festival. In addition, on social media, there were 27 posts put out and with impressive stats, albeit I'm not an expert on social media, but there were 15 million post impressions. The reach was 1.2 million and 40,000 engagements with the campaign online. It's been mentioned earlier that in the post-show survey, 89% of respondents said they saw the campaign, and that was there were 19,000 respondents to that survey, and they were also able to provide comments on the campaign which were overly positive. They thought it was a good idea, really good messaging, inclusive, not in your face, targeted effectively. They saw it frequently on the stage screens, on social media, someone even said all over the place, and festival goers, many of which witnessed people helping each other, helping friends, which was really, really positive for the campaign. I was actually at the festival for a few hours on the Friday and was blown away, not by the winds, although they were pretty strong, but by the extent to which the campaign was across the festival. And last week a task and finish group of the FACT, which is a subgroup of the main group, met last week to review the animations and the messaging. We're making amendments as we speak, ready for the festival this year. Thank you, Chair.
Wonderful. Thank you very much for that. Councillors, do we have any questions before we close? No? In that case, thank you very much for everybody who's contributed to a very thorough discussion yet again, and I'll see you all soon. Well, when is it? August? Yeah, the next one. Yeah, good luck. Thank you very much.
Chair, members, thank you very much indeed. Thank you.
I'll give you about a minute, members, and then we need to vote on the recommendations. Right, who are we waiting for? Who? She's left, has she? Right, members, we have the recommendations which are on page 11 of the agenda. So the Licensing Committee is asked to hear from reps of the Festival Republic and Safety Advisory Group. We've done that. Are we happy with the information? And are we happy to support that members are keen to attend one or both or two of the working groups? We've already agreed that Ed and Sharon are going to go to sustainability. Is that still okay? You're not nodding, but you're not shaking your head, so I'm saying that that's affirmative. Taxi and traffic, we've got Asgar and Lisa. Yeah? Okay, is that all right?
Yes, thank you.
Smashing. Okay, so now we're on agenda item number 8, which is health as a licensing objective. We've got Sue and Magdalena from Public Health to present the report. Thank you.
Thank you, Chair. Members will be aware under the Licensing Act we have 4 licensing objectives. So we have prevention of crime and disorder, prevention of public nuisance, promotion of public safety and the protection of children from harm. In 2012, Public Health became a responsible authority under the Licensing Act and were able to make representations to licence applications and to have a more active role in our policy setting. However, what the government didn't do was to give them a licensing objective to work under. And so as a consequence, for the last 10 years or so, Public Health have made their representations concentrating on the protection of children from harm. We believe that there is far more that Public Health can bring to the table. And in this report, we would ask you to consider what action may be appropriate to bring that about. If you don't mind, I will pass over to my colleague Magdalena Boo, who is Public Health, and she will just give you a little bit more information.
Thanks, Chair. Thanks, Committee. So our starting point as Public Health is that alcohol's a harmful commodity and that the alcohol industry is an unhealthy commodity industry like the tobacco industry. And alcohol's a legal but potentially lethal product. And we know that the availability and affordability of alcohol and exposure to alcohol in neighbourhoods is a commercial determinant of health. Now, the World Health Organization advised that any alcohol consumption is harmful and there are no safe levels. Alcohol directly causes at least 7 types of cancer, including breast and bowel cancer. Our focus is usually on higher risk levels of drinking, and we advise people who do drink alcohol to follow the Chief Medical Officer's advice for low risk drinking of no more than 14 units a week on a regular basis, spreading drinking over 3 or more days and including several drink-free days. However, we must be clear that those drinking at lower risk levels will experience health harms, including cardiovascular disease. And those harms aren't immediately felt but develop gradually. So we talk about communicable disease and non-communicable disease. So communicable disease, if you sit on a bus next to somebody who's sneezing and a few days later you catch a cold, you can see the cause and effect. But it's much harder to see health harms that have developed over several years and link those to alcohol consumption. But it is clear that alcohol consumption causes death and disability relatively early in life, and that depends on the amount of alcohol consumed, the pattern of drinking, and factors such as biological sex, health inequalities, deprivation, and these can influence health harms. So those who are male and those who are more deprived experience more health harms. And that's not to blame anyone for those harms, because blame and stigma are unhelpful. So we're trying to present this evidence of health harms succinctly, so we're all on the same page of understanding that alcohol causes health harms, and to understand why, as a responsible authority for alcohol licensing, Public Health wants to minimise those health harms. So how do we protect our communities from alcohol-related harms? As well as providing outstanding treatment in services in Leeds for those directly impacted by alcohol harms, we also, at population level, try and prevent people in Leeds from being harmed in the first place. And this upstream work includes work on licensing to manage the alcohol environment in Leeds. The Institute of Alcohol Studies describes the use of licensing laws to restrict the physical availability of retailed alcohol via reduced hours of sale as among the World Health Organisation's best buy interventions for reducing the prevalence of non-communicable diseases. Public Health is a responsible authority for alcohol licensing. However, there's no public health licensing objective for alcohol, despite repeated calls by the local government associations for such an objective, and more recently from the Association of Directors of Public Health. So at present, as Sue said, public health can only link our evidence to the protection of children from harm, and underage drinking is already covered by law. There's no mechanism that enables us to object to premises licences on the grounds of protecting the health of residents in that area, even when we have evidence of high alcohol-related hospital admissions and deaths and high numbers of residents accessing alcohol treatment. The lack of a public health licensing objective severely limits the data on health harms that can be presented. Licensing committees can receive information on acute harms, such as alcohol-related violence, because of the objective on the prevention of crime and disorder and public safety, but you're unlikely to hear about chronic ill health and early deaths caused by alcohol. We've got a wealth of data on alcohol health harms at MSOA level, some of which we're able to convey through the alcohol licensing data matrix. But this could be given more prominence in decision making, and it could be more effective if public health was an alcohol licensing objective. At present, though we can present our data, there's no objective to link this to, so it can't be a valid ground for refusal of a licence. Importantly, any decision that's made today won't change the situation for Leeds. Licensing legislation is a national decision. There are a number of different options on alcohol harms that could be enacted nationally, which could potentially turn the tide on alcohol harms. And not all of these will be acceptable to Leeds stakeholders, and many of them, probably all of them, would require national consultation. So things like minimum unit price, alcohol harms labelling, and public health as a licensing objective are those sort of measures at a national policy level. In Scotland, there's been both minimum unit price and public health as a licensing objective for a number of years now. And although alcohol deaths in Scotland continue to rise, they've risen more slowly than England, and that shows that such policy actions are potentially life-saving. So although the policy in Scotland has reduced deaths and hospitalisation wholly due to alcohol, there's more that needs to be done around social norms and culture around alcohol in Scotland. So we're not saying if we had this in Leeds it would be a magic bullet and it would solve all our alcohol problems. It's important to say as well that in Scotland the most deprived experience alcohol-specific deaths 4.5 times higher than the least deprived. So we're definitely not saying this is a solution of all our troubles on alcohol-related harms. And it's important that we don't see alcohol licensing, public health and alcohol licensing objective in a vacuum. We need to consider our other plans, such as planning, advertising and sponsorship, and marketing of our city, because that impacts on our local alcohol culture and alcohol environment. We're part of inclusive recovery cities. We have collegiate recovery on our campuses, and we have sober events alongside continuing to support our outstanding local alcohol treatment services. Got lots of alcohol facts, local alcohol facts, which I'm not going to read out because I think it'd be great to have some time for discussion here, people's views. Thank you.
Great, thank you very much. Questions, anybody, please indicate now. I have got Councillor Buckley waiting who can go first.
Thank you, Chair. I've got 2 or 3 comments and a couple of questions, if I may. And I'm broadly sympathetic to this proposal. I wouldn't instinctively normally be sympathetic to what could be seen as an extra bureaucracy and an extra inhibitor of economic activity. But in this case, I am sympathetic to it for the reasons that you've outlined. But I think we're in danger of dancing round the issue here, because you mentioned 14 units of alcohol per week. Well, I'll be honest, I drink more than 14 units of alcohol a week. I don't know about people around the table, but what we're talking about here is a massive amount of people drinking a lot of alcohol, a great deal. And we've heard in the report about people on the street and so on. And that's why I asked yesterday for a breakdown of every ward in the city and how many off licences do we have in each ward. Because when you're talking about 44 off licences and 39 off licences in Ward A and Ward B, Bermontoffs and Hare Hills and wherever it is, that's about 12 times the number of off licences that we have. I think we've got one in all Woodley. You know, I believe that the police, as well as licensing, should be closing these places down. I know it comes to committees, subcommittees, and we've had difficulties with some of them, but the sheer number of them, and it means that any application for a further premises, a further off licences, means that that cannot possibly be selling duty-paid goods. It has to be contraband, because how would it not be if 43 of your competitors are selling contraband stuff? And just finally, Chair, page 26, there is a 7th area being investigated at this time, apart from the 6 problem areas. I'd like to know where that is. And just a comment, if I can, on page 27, at paragraph 20. You mentioned these premises supply cheap, high-strength alcohol. Well, it's not cheap, it's contraband. That's why it's so cheap. It's a quarter of the price it should be. And a culture of drinking in large family groups, socially and outside their homes. This creates community tension with groups who do not have a culture of drinking alcohol. What does that mean? Does that include the indigenous population? I'll leave it there, Chair. Thank you.
I mean, so I'm sure, well, it's for both of you guys to respond to that. I'm sure you'd want to comment on Clear Help Build and some of the successes that we've had there. But I mean, Councillor Buckley, you will be aware that there is an issue with our strategy on Clear Help Build, in that there is a gap in the legislation that allows transfer of licences that we do need to look at as well, and is being looked at by this licensing committee. So perhaps we won't go into too much detail in that, since it's a public meeting. And we're all aware of those issues, but I'll hand it over to you guys.
Okay, very quickly, the 6 priority areas that we have at the moment, we have 6 community of impact assessment areas in place. The 7th will be Beeston CIA, which is the next report on this committee. So we'll talk about that in a few minutes. Regarding the Hare Hills issue, this is a long-standing issue that we've had in Hare Hills, where we have got 2 quite disparate cultures that live side by side, and it creates a lot of unhappiness and complaints. We are dealing with that in Hare Hills through the Clear Hole Build protocol. And you'll be aware that we have reduced the number of off licences in Hare Hills from 30 to 20. So we're doing quite a lot of work there, especially with trading standards and immigration and other partners to deal with that issue, and I'm sure that members here will confirm that this has made a massive difference in that area.
Can we have this breakdown ward by ward, please?
I haven't got that information to hand. I can get it for you. That's not a problem.
Did you mention the 7th area?
Yes, Beeston. And that's the next report that we'll be dealing with at committee.
But Beeston's on here. 1, 2, 3, 4, 5, 6 wards are mentioned here, but you say there's a 7th ward.
So we have community of impact assessments in City Centre, Headingley, Hyde Park, Armley, Hare Hills, Holbeck, and then the 7th will be Beeston.
Okay, I've got Jordan next and then Lisa, please.
Hi, yeah, I've got a question and then just a couple of comments. So the first question, it's okay if that information isn't there, but on section 10, page 25, it's talking about the House of Lords Select Committee. Just right at the end, promotion of health and well-being is a necessary and desirable objective for an alcohol strategy, but we accept that it is not appropriate as a licensing objective. As I read through it, it didn't exactly explain why that was. So if that would be great. And then I guess the comments that I've got is I think what you've brought is really brilliant, and it makes a really strong case of including health in a licensing objective. My only thing is when I've read it, I think the antisocial behaviour stuff weakens it. And the reason why I say that is I think it would then bring massive contradictions to what we consider acceptable in regards to on-licensed premises and off-licensed premises. So I guess what was mentioned in Hare Hills, there is a culture of drinking outside, but how many on-licenses are there in Hare Hills? So it's like, drinking isn't necessarily antisocial. If anything, it's very social. So it's like, I just think the antisocial behaviour stuff weakens the report personally, and I think sticking specifically to health is what I think would be more of a success if it goes to the LGA and then to the government. I just think the antisocial behaviour stuff weakens the argument that we might put forward. Thank you.
With regard to the outcome of the 2 or 3 times it's been to government before, the LGA have very strongly recommended that health becomes a licensing objective, and I think they put forward health and well-being the first time around. Each time the government select committees have come back and said that the health data that is provided is too broad, because in licensing terms we look at bricks and mortar premises. They felt that you couldn't draw the health data down to a locality basis. And I'm afraid I don't agree, because we use the alcohol risk matrix on a locality basis all the time, and we do it to postcode level. So I can't see why we can't look at health data for a locality specific area, and I feel like they've missed a trick. Now, we did discuss this, the matrix and so on with the select committee, but they didn't. I think they were swayed by other arguments at the time. As I say, we don't believe that health data is too broad. We believe it can be specific enough.
Lisa.
Yeah, thank you for this, Sue. I've sat on a number of licensing subcommittees where we've either refused or restricted alcohol licenses, taking on board some of the data that you've referred to. And I've got no doubt that when you come up with the list of off-licenses that Councillor Buckley's asked for by area, that there will be a strong correlation between early mortality rates in those areas and the off-licenses, because, as I've seen, they tend to be clustered in the most deprived areas of the city. but my question is really, so we're lobbying the LGA. The LGA are supportive. What more? Is there anything more that we can do as a local authority immediately to use what you've said here? Or what are you asking us to do as a local authority or as councillors today?
Well,
Thank you.
That is up for discussion on the recommendation. So part of the recommendation is, where are we? What are we? Number 8, aren't we? To receive the report and then consider any action that might be appropriate. So my recommendation was, obviously the LGA are already doing this, but I mean, I've jumped to this bit. My recommendation was that we write to the Secretary of State for Health and Social Care and Housing, Communities and Local Government, saying that we've passed this report. But I mean, that would be one recommendation. I don't know if
okay. Yeah,
anybody
I mean,
else has got any recommendations.
That's an absolute no-brainer then. Thank you.
So just, you've obviously said writing to the Health Secretary and that. Who's the Secretary of State in charge of the actual licensing law? Because I think we've discussed this in the subcommittees and everything else, and it raises, it goes with Councillor Buckley's point that if there's 44 off licences in one place, even if a new one comes in with the intention of running a reputable business, they're not going to be sustainable if a handful of them are run by crime gangs, which we know is happening. But because of how weak the licensing laws are towards what the police can do with the off licenses, and we've discussed it before, it needs to be, they should be able to go in, pull that license, and then that license is frozen, so it can't be transferred, it can't then be sold until the investigation is completed, and then it comes to a subcommittee with it, and this is one of the issues. So shouldn't we be lobbying the MP in charge of licensing law to get the overall changes done as well?
I guess my recommendation then would be is if we are writing forward, and I guess part of the evidence will be this report, and my recommendation would be to take out the parts about antisocial behaviour. I think it weakens it. I think the aim should be specifically health. I think that makes it stronger, and there are clear data that we can show. Again, the point I would make is if we start bringing in antisocial behaviour and calls for antisocial behaviour, I think that would have a knock-on effect on licensing, because I don't think you can then make that argument that, you know, we did a sub-licensing talking about, you know, a really great drinking culture happening in smaller villages in Leeds and stuff. We were on there together, and there is antisocial behaviour related to that, but we also know there's a benefit to it as well that we have to take into consideration. If it's down to antisocial behaviour as a health, I think that would then have, I would say, detrimental effects to drink it. City centre. If we took in the antisocial behaviour that came from drinking in the city centre, we'd have to close down many places. That would be my suggestion. I think it's too open-ended and it weakens the report.
Magdalena, do you want to comment on that and suggest a way forward?
Yeah, I've got no objections to taking that out. That's not a problem.
The last thing we want to do, we all appreciate the importance of licensed premises, you know, pubs, restaurants, clubs, gig arenas, whatever, that they play to the role they play in our city and the cultural fabric, and the economy as well. The last thing we want to do is sort of be seen to restrict those. We want to support them as best we can, but we've all been in situations on licensing subcommittees where we know that there's a detrimental impact of a possible licensed premises, normally an off license in a particular area, and we feel that we can't do anything about it. And I think that's what this is about. It's not stopping great pubs, restaurants, bars, gig venues from opening up. Sharon, did you want to speak?
Yes, I just wanted to say I welcome the report. However, we're all talking about off licensing. We need to make sure we don't create another problem by when they're closed down, people start opening up premises, food, you know, to start having restaurants, because they sell alcohol the supermarkets sell alcohol, so you might close down 20 or 30, say, for example, in Errol's and Gipton, but then there's Tesco's up the road and other supermarkets. So, you know, we need to make sure that we're not just concentrating just on off license. It's got to be all licensed premises, because when you can shift the problem from one to another.
I think it would be health as a licensing objective, so it would be, I guess, an amendment to the 2003 Act, which would apply to all alcohol licensing. If I'm right, am I right? I'm right, there we go.
Yeah, I think the only difference is that because it's about the affordability and the availability of alcohol is quite key to harms, where you've got kind of 24/7 and cheaper off-trade, that you might have higher harms. But you're absolutely right, that Councillor. It's, you know, all alcohol from anywhere could potentially be harmful.
In the supermarkets, you can get cheap stuff as well. It's not just off license. You know, we need to make sure we don't shift the problem from one to the other and take everything into consideration.
I would just say to Councillor Hamilton that Tesco paid duty on the drink, and these people don't. That's the huge gap.
Yes, Councillor.
I'm glad to hear different sides of the stories and things, and I've been in the middle of this with Clearhole Build. You know, that we say about culturally, there's no such a thing as being culturally and drinking something that's not paid duty or taxes in this country at all. And the strength of those alcohols, you've no idea what's in them. That goes for the vapes and the cigarettes that come from Belarus. So here, it's not about culturally, it's about the availability. And you've got one shop that was actually selling alcohol that was duty paid. I take the point what Councillor Hamilton has said, and I take what Councillor Buckley has said across there as well. That yes, Tesco's do sell cheap booze, but it's nothing compared to the strength of these local shops are selling. What do you mean when you say culturally? I'm a councillor in a ward that sees a carnage of this. We've reviewed licenses, 12 licenses. Across the country is 2.3. We've reviewed 12, 13, 14, 15. And there is no such a thing as culturally. There isn't. It's the availability of that alcohol, and then there has no duty been paid to revenues and customs or anything else. In fact, they are adding to the problem, and that's with antisocial behavior. They're targeting children, they're targeting families, and it's, once again, we wouldn't allow street drinking within the city centre. We wouldn't allow it. There isn't any street drinkers. You go around city centre. I've worked 36 years in the city centre. You wouldn't see this and then class it as culturally. You wouldn't do that. So why would you class this culturally here in a report number 20 here on page 27? You wouldn't.
Yeah, I apologise, Councillor. We were using that as an example of how we use the health data matrix. And it was to illustrate the fact that we feel that the health data that we have can be brought down to a locality. It was just an example of how we use health data already. It probably is a bit distracting and I should take it out. It wasn't meant to be specific to one particular locality. It was trying to be an example of how we use it at the moment, but you're quite right, we'll remove it.
But I would say there are, when you talk about culture and drinking culture, I'm not talking about culture as in ethnicity. So student culture, people might think that as a student that they have to drink regularly and heavily, And certainly in the past, that's what people would have associated with student culture. And that's a harmful social norm about being a student. Now we've got collegiate recovery in Leeds, so as part of freshers events, there have been sober events, alcohol-free events that are brilliant for students who don't drink for whatever reason. So the alcohol environment and the alcohol culture and the drinking culture on campuses in Leeds is changing. So if you think about culture as in terms of social norms, the way we do things around here, having a culture that isn't, this is heavy drinking is what we do around here. Heavy drinking's the norm. Heavy drinking's okay. That's what when I would talk about drinking culture, that's what I would be talking about rather than particular ethnic cultures. Hope that makes sense.
Okay, so the recommendations is to receive the report regarding health as a licensing objective, and to consider any action that may be appropriate. And I think the actions that we've taken is that we shall write to the Secretary of State for Health and Social Care and the Secretary of State for Housing, Communities and Local Government. We just need to double check that the Licensing Act and the responsibility for that does fall under those, it does fall under Housing, Communities and Local Government. Obviously, so you're shaking your head. Who does it fall to?
Sorry, it's the Home Office.
Is that right? Okay. Okay. Well, then in that case, we need to write to the Home Secretary and whoever the junior minister is in charge. I mean, we could still write to Angela Rayner anyway. Make her aware. Still sort of in her remit, isn't it? As it is Wes's indirectly. Wes Streeting. Sorry, I don't know him personally. My best mate Wes. I have never met Wes Streeting, so right, okay. And the other recommendation as well is that we remove the reference to antisocial behaviour in the report.
Are we in agreement? I'm happy to do it.
Well, they're the recommendations as a whole. Are we all in agreement of those recommendations? Councillor Buckley.
Just a thought, you may think it's a bad idea. Would it be possible to suggest a maximum number of outlets per ward?
I think you're in very dodgy territory there, given that each ward's so different. I mean, one off licence may be fine for all Woodley, but it wouldn't serve, say, I don't know, Chapel Allerton and Chapeltown that is so, has more Little London and Woodhouse or whatever. Yeah, I think that'd be very, very difficult to do. I mean, I'll ask Sue's opinion on it, but
I think how each ward is so different. I think it would be very difficult. When we were looking at the numbers before, you could say that we have 12 off licences in Armley. That might be a lot for Armley. It might not be very many at all. It's very difficult to say, isn't it?
It's more the fact that if we can get them all playing by the same rules, it doesn't really matter how many. In a way, it doesn't matter too much how many off-license you have. If they're all selling at the same price and it's all legitimate,
well, absolutely.
So obviously there is a case of you can saturate a market with too many, and that may increase the problem. But if they are all selling at the same price, it's more with the off-licenses. It's more the fact that they're selling so cheap that attracts the street drinkers. So if we can get rid of that bit, it should have a knock-on effect.
Right, are we all in agreement then? Yeah, on the recommendations. Smashing. Thank you very much. Right, we move now on to agenda item number 9, which is the CIA, Cumulative Impact Assessment for Beeston. Who's introducing this? Sue again. Thank you, Magdalena.
Thank you, Chair. This is the report bringing you the Cumulative Impact Assessment for Beeston back for approval. This has been in front of you before, and it has been out for public consultation. As a cumulative impact assessment, it was supported from the Off-By Communities team and those agencies working in the area. They were the ones that requested that we look into this in the first place. And it has been well supported by people living in the area. It went out to consultation. We received just one response, and it was from somebody who was also in support. That information is in the cumulative impact assessment at page, bear with me, at page 63. The recommendation is to put a cumulative impact assessment in place for the area that runs along Dewsbury Road to Crossflats Park, up Tempest Road and down Beeston Road. That's the area in which we have evidence of problems, and that's the area that the agency supported. I'm happy to take any questions.
Any questions? Yes, Kate.
On Dewsbury Road, the map shows that the area will run up the middle of the road. Is that correct?
Yes. We normally take it behind the shops on either side of the road. That's what we would normally do, so that you have. So, yes, it would be. So it would run along the shops on the eastern side of the road. I'll make sure that it does that.
Yeah, okay, I think that would be clear, and obviously you can't really have cumulative impact on one side of the road and not across the road, because that just would lead to, I think, a lot of confusion.
The map on page 44, which shows the proposed CIA area, it does include the quite a wide margin either side of Dewsbury Road. Yes, yeah. So it runs up the edge of the park, but it also runs.
You. That's clear now. Yeah.
Yeah. Okay.
Thank you. Yeah, I'm really in support of this. I did just have, and I mean we've spoken about it before, I did just wonder if there was a particular reason why, for example, you decide to exclude the Bartons, which is kind of, do you know, just off Cemetery Road, kind of top left. And yeah, particularly the Bartons, that's actually in Beeston Holbeck Ward, as you're going towards the motorway. And yeah, and also in my mind, the estates, the Disraelis, Bismarcks, etc., Northcotes around Hunslet Hall Road are very similar to Waverley Garth and the Greenmounts around there. Anyway, I don't have a strong opinion. Presumably you've got reasons, but I'm just interested to know.
So when we designate the area, we do it in conjunction with the teams that are working in the area. So we literally I sat in a meeting with them and we drew a line around that they were comfortable with. But it has to encompass the licensed premises, not the residences. So this includes the premises that are on Beeston Road, the majority of the premises that are on Beeston Road, as well as ones that are down Tempest Road and along Dewsbury Road. Other than that, the area is, we tried to make have a sensible boundary. But the reason why it doesn't include the Malverns and the Hunslet Hall Road is because there aren't licensed premises there.
Yeah, just a comment really. I'm supportive of this. I think it's got to happen really. with a proviso that an area like Beeston, Dewsbury Road, it obviously needs regeneration, and it would be a shame to turn down a nice restaurant and that kind of thing on the back of this. So as long as there's a balance there to tackle the bad applications, I'd be in favour.
This particular CIA, the scope is off licences and late night takeaways, and that was around the late night takeaways because of littering, that we have a lot of complaints around litter. So something like a restaurant or some unlicensed premises that wouldn't be caught underneath this CIA.
Right, the recommendations for this are on page 33, which are for licensing committee to consider the attached CIA assessment and, if appropriate, approve the assessment with immediate effect. For licensing committee to refer the amended section 7 of the Licensing Act 2003 statement of licensing policies to full council for approval. So it wouldn't be enacted until it's approved at full council, but we'll kick it up to full council. Is everybody okay with that? Excellent. Okay, in which case we're on agenda item number 10, which is effectively the end of the meeting. The next committee meeting will be on Tuesday the 18th of March at 10 o'clock. And that's the end of today's business. Well done, that was a very busy meeting, very thorough. I appreciate your time and the effort you've all put in. Thank you.
Members, just before you all leave, I'll do one of my usual shout-out housekeepings. I'm still looking for a third member to join the licensing subcommittee on the 3rd of February. So if you wouldn't mind checking your diaries and just sending me an email, that'd be great. Thank you.